Hi everybody, happy Friday, and thank you to those tuning in live and those of you catching the replay, or maybe you part some of this on Tuesday and you felt like coming back. I'm Dr. Catherine Powell, owner of Powerful Physical Therapy here on Long Island. I know patients are busy, so I travel to you, and if you're on Long Island, I come to your home. If you're a little bit further away in New York, I can treat you virtually through telehealth. So all sessions are always one-on-one, and your goals are ultimately what's important. Before we get started on today's neck and back relief workshop, I just want to say thank you again to the Wellness Festival and the American Cancer Society going on this week. There have been a ton of great workout classes and courses going on. There's more tomorrow, so definitely check them out if you haven't already. And any donations will benefit the American Cancer Society, so any amount goes a long way and it would be greatly appreciated. So, since COVID, many people have been working from home. They've been dealing with increased neck or back pain from sitting so much, not being able to go to the gym as regularly, and many people are still working from home. And sometimes, if you have a desk job, it's hard to stand up or go for a walk. So all the exercises today you can do while seated, and they don't take a ton of time, but the more you do them throughout the day, and the more consistent you are with them, the better off you'll be long term. So none of these exercises should increase your pain or symptoms or add to any tension or headaches you've been experiencing. So if they do increase your symptoms at all, definitely reach out because you would benefit from a more thorough evaluation and come up with a specific plan for you. If you haven't had physical therapy before, what an evaluation entails is we go through your medical and injury history, and then we talk about your goals and what you hope to get from the sessions together. And then we bring you through a series of movements and special tests to determine what tissues are causing your pain or contributing to it. So is it a muscle, a nerve, a bone, joint, ligament, tendon? And we also screen for red flags as physical therapists. So if we're not able to reproduce your pain or how you describe it just doesn't match up with what a normal rotator cuff tear would present like, or back pain and sciatica, we also make sure to refer you to the appropriate provider if we think something else is going on. So red flags could indicate something more serious like cancer, and these symptoms include bladder bowel dysfunction, vomiting, drastic changes in weight loss or appetite, severe night sweats or night pain, severe numbness, tingling, or weakness. So if you or anybody you know begin experiencing those symptoms, definitely see your physician right away. Personally, my dad's been battling multiple myeloma for a few years now, and he had back pain for years and sciatica, and he's the type to just suck it up and keep going. So he didn't tell us that he was experiencing these red flags. He also just kept thinking, oh, maybe I ate something funny, that's why I threw up today. And it wasn't until it became a medical emergency where he was unable to get out of bed and walk that he finally got admitted, and then 3 days later he underwent spinal surgery. And 2 days after that is when we received the diagnosis of cancer in the bone marrow. So for his situation, the cancer had made his bones very brittle and soft, so they were compressing the spinal cord and the nerves, and that's what was triggering all these red flags and all his other symptoms. And after he had surgery, he also had to maintain his spinal precautions. So depending on your surgeon's preference, you're usually under these precautions of no bending, lifting, or twisting for 6 to 8 weeks. But given that he was about to start cancer treatments at Sloan, and traditional cancer treatments delay wound healing, his precautions were extended for 12 weeks because he couldn't afford to rupture the stitches and have to go back under the knife. So as physical therapists, we're trained to work with patients at all different stages of cancer and cancer treatments. So in my dad's acute phase, his main goals when he was first very sick was just to be able to get out of bed safely, be able to sit at the edge of the bed unsupported, and safely walk to the bathroom or propel himself independently in the wheelchair. So we were just trying to improve his activities of daily living and allow him to get around the house once he was finally home by himself or with minimal assistance. As he's gotten better and or has been throughout more maintenance treatments, now he's had different musculoskeletal injuries or pains arise, and so trying to decrease his pain, improve his function, and allow him to do his hobbies in the garage and around the yard without as many restrictions. Cancer treatments, as any of you who are currently going through them or have a loved one, you know how fatiguing it can be or how many side effects there are, and that can be very debilitating for people. But you're going to feel cruddy whether you stay in bed all day or if you get up and move, and we know how beneficial exercise is for you, so even if you can muster up a little strength to just do something each day, that is going to help you tremendously. And then for the people who have survived cancer and beat it, and maybe it was recently or maybe it was a few years ago, but you still have these secondary impairments or limitations from all the tests and procedures and medications you went through over the course of your treatment. So we can also help you where you are now and where you want to get tomorrow. So cancer is no longer the issue for you, but maybe you want to move your shoulder better, or you want to be able to walk more, return to sport, be able to get on and off the floor to play with your grandkids. So these are a handful of different things that we help people with every day. And now going it back to the back and neck, some common diagnoses I treat are stenosis, spondylitis, spondylolisthesis, sciatica, herniated disc, bulging disc, arthritis, degenerative joint or disc disease, whiplash, fractures, and people dealing with both acute and chronic pain. And for those of you who have been in pain for a while, I know it can be frustrating and tough dealing with that pain all the time, but it is possible to get better. It just takes time and consistency, learning how to move better, learning what's contributing to your pain, and then knowing what to do about it. And we all want the magic pill or the quick fix. Sadly, that does not exist. But again, it is possible to get better, and you don't just have to deal with this pain long term. So for those of you working from home, the first thing you should evaluate is your desk. How are you sitting when you're at work for 8 hours a day? Is the height of your chair okay? Is the height of the desk okay? Is your monitor at eye level, or is it below you and you're looking down? Is the keyboard too far, or are you able to rest your hands comfortably on your desk and keyboard, and your armrests are at the right height for your elbows so that they're not shrugged in your ear? And that, if we're in these poor postures or for longer periods of time, or again our environment is kind of pushing us into a worse position, that does take a toll day in and day out. So we want to be able to counteract the 8 hours when we're sitting, and if we can at least optimize how we're sitting and in the position we're sitting, that's going to decrease any pain, stiffness, or discomfort. So when we're looking at the screen, especially those of you who have trouble seeing it and you're leaning forward, this is putting a lot of stress and strain onto the neck. So the front of our neck gets very weak and stretched out, and the back of our neck muscles, they get tight. And that contributes a lot to tension headaches, as does straining the eyes. So try to make your font larger, see if you can bring the screen closer, and again, up to eye level and not looking down. And just those couple of adjustments will help. So in order to combat that forward head posture, we want to do a chin tuck. So it's making a double chin, you push your head back, hold a few seconds, and relax. Push back, make a double chin, hold a few seconds, and relax. You can do this in the car, you can do this while you're sitting on the couch, at the dinner table, you can do it standing. If you need a cue, you can stand up against a wall as you push your head back. And then as these get easier, you can start to hold for longer periods of time, because our deep neck flexors, they're our endurance muscles. Our heads on average weigh 12 to 15 pounds, so it takes a lot of strength and endurance to hold our heads upright. That's why after a car accident, somebody who has whiplash, they know how tough it is to keep their heads up, and that's why you see people in the cervical brace. Another thing we want to do are neck rolls. Now I'm sure most of you have done this just because it feels good. You know you need to move. But one thing you can think about as you do this is you want to imagine a string pulling you up towards the ceiling. And then with that string still decompressing the spine, so you're in an upright position, then you rotate over that point. So you're imagining the spine, you're decompressing it, you're increasing that space between the vertebrae that are stacked on top of one another, and then pivoting over that point. If you find any spots along the circle that you're more tight in, hold it there and try breathing. So for me, it's when I lean my head back. So what I can do is just pull below my clavicle or my collarbone and breathe into that tightness. So a common compensation I see here is that when people are tight along their anterior neck, the body is smart, it's resilient, and it's going to find the path of least resistance. So people bring their head back and then their jaw opens, because now that's shortening the tissue along the front side of the neck and decreasing the stress or the stretch to it. So try keeping your tongue on the roof of your mouth as you lean your head back. Breathe into that tightness, and if it's a little too intense for you, you only have to hold it a couple seconds and just gradually ease into these new positions. So the upper trap and the levator scap are two muscles that run along our shoulders and up to the base of the skull. These also contribute to tension headaches and neck discomfort, and oftentimes when we're stressed, our shoulders come to our ears, we stop breathing, and this adds to a lot of tension. So we want to also efficiently breathe as we're stretching, as we're working out, as we're just doing things day in and day out. So if you start noticing yourself breathing with your shoulders, try to relax them and breathe more with your belly. So as you take a big breath in, only your bottom hand should move, so your belly goes out, and as you exhale, your belly goes in and you squeeze your core. So your top hand doesn't move much as you're breathing in and breathing out. For people with respiratory disorders like COPD, emphysema, or who just battled COVID, it becomes very strenuous for them to breathe, so they have to recruit all these accessory muscles. And so by doing diaphragmatic breathing and strengthening the diaphragm, that actually improves respiratory function. And so, again, our traps get overworked because whether we're breathing, whether we're holding onto stress and tension, that's then putting stress and strain throughout the neck. So to stretch this muscle, you pull your head to one side and you rotate and look up. If this isn't enough of a stretch, you can hold the side of your seat and lean away or lean towards the side you're pulling. To make this a little bit more active, you can actively depress your shoulder. So you're pulling your head and you're trying to drop your shoulder closer to the ground. So you should really feel a nice stretch along the side here. Now to stretch the levator scap, this is the Michael Jackson stretch. This is looking towards your armpit. And you can do the same thing of holding onto the chair and leaning away. Or you can depress the shoulder, reach for the ground. If this is too much pulling on your head, or maybe you have a shoulder injury or pain going up here, you can just hold the side of the chair and floss in and out of this position. And a lot of people early on in rehab, they really can't tolerate holding these stretches for 30 seconds. So I always tell them work in your best available range. Do start with 5 seconds and gradually work your way up. Or again, even if it's just a couple of seconds, come here and back up. When our tissues have been used to being tight for so long, or used to these comfortable postures, which might not always be optimal, when we start to introduce movement and work into a new range, sometimes the body likes to cramp up or likes to say, no, I'm not comfortable there, and they get a little tight. So it's normal to expect some soreness when you first start introducing new exercises. What's not normal is to experience an increase in pain or like really bad, sketchy feelings that you know something's not right. Obviously then you stop and don't continue that and consult a professional to see what's going on. So another thing, when we're sitting at our desk all day, we tend to slouch. We're all guilty of it. And our shoulders round forward. So what we want to do is strengthen our upper back. So our rhomboids, our mid-trap, our low trap. Get the shoulders down and back and open up the chest. So we do this with a scap retraction or shoulder blade squeeze. So imagine you had a pencil between your blades. You're squeezing down and back. Hold a few seconds and relax. Squeeze down and back. Hold a few seconds and relax. A common compensation I see with this is when people begin it, they go up and back and they shrug their shoulders. Again, that's only reinforcing the traps that are already tight and hypertonic. We want to relax that, and we want to strengthen the weaker lower muscles. So it's down and back. You can also do this as a chest opener, so arms straight out to the side like a T, and just squeeze the blades as you bring your arms back. If you want, you can put your head or hands behind your head, touch the elbows, squeeze back. So find whichever position works for you. Obviously we're doing these seated, but you can do them standing. You can mix them into your daily routine and find whatever time of day works for you. So now as we travel down the spine, we also, as much as our spine is our stable base and we want to be able to accept forces and loads as we carry objects or go to lift and move different things, we also need to have a good amount of mobility and stability. So our spine should flex and extend, side bend, and rotate. If we're tight or restricted in any of those directions, that could predispose us to injury or not being able to effectively transfer a load and the forces that come with it as easily. So just as with the neck rolls, when we imagine that string pulling you up towards the ceiling, you're going to do the same thing. Imagine the whole spine is being decompressed. You're sitting up as tall as you can. You're taking a nice big belly breath, and on the exhale, you're rotating back. And then you could take another big breath here. On the exhale, try to rotate a little bit further. Come back to center. Again, reset if you need to. Imagine that string's pulling you up. Big breath in. On the exhale, rotate behind you. Another big breath, and rotate a little bit further. That one usually feels great, and most people forget about rotating, so definitely do it several times throughout the day while you're standing or while you're sitting. So now as we travel down to the low back or the lumbar spine, our hips also play a role here in regards to tightness, strength, and sometimes back pain can refer pain down the leg or vice versa. So that's what we also screen for during a physical therapy evaluation. We try to figure out, is your foot pain truly from the foot or is it actually coming from the back? And sometimes when a nerve is getting trapped, either where it is exiting the spine or maybe down the chain, that's what we want to try and free up to take away that distal pain or that pain in your foot. So the hamstrings run from the back of the knee to our butt bones, the ischial tuberosity. And our sciatic nerve is this big, thick, rope-like nerve, exits our back, runs through the glutes and down the legs. So sometimes if we have tightness in the hamstrings or tightness in the piriformis, which is the stretch we'll do next, that can compress the nerves, causing the numbness, tingling, burning, or radiating pain down the leg. So when we stretch the hamstrings, in order to fully stretch them, we don't want to just reach down for our toes and round our back. So this is just stretching our low back, and while there's a time and place for that, that won't be effectively stretching the hamstrings if that's the tissue we're targeting. So we want to hinge at the waist, so you keep your back flat and hinge forward. Imagine there's a roller coaster bar across your waistline and you're hinging down. And now you should really feel it along the back of your thigh. Having that flat back and doing that hip hinge, is very similar to a deadlift. So that's how you should go about picking up different things from the ground. Or when you bend down, use your legs and not your back, because that too can predispose us to risk of injury. So you can also floss in and out of this position. You don't have to hold it for 30 seconds, but if we move in and out, we're now trying to mobilize the nervous system. Our nerves, think of like dental floss. They should be able to slide and glide under the tissues without restrictions. If we have a tight muscle that's restricting it, that gets bound down. So by moving in and out of a position of tension and slack, that can help get it unstuck. So now going into the piriformis, or a muscle that runs across your butt, that we can stretch by bringing one leg over the knee and pushing down. Ideally, your tibia or your shin bone should be parallel to the ground. If you have tightness, like myself, your knee comes up a bit. As you can see, my left side is tighter than my right, so that's the side I'm going to work on. So you can either try pushing it down and holding for a few seconds, taking some deep breaths at this end range position. You can also try pulling it to your chest. So you should feel it along the back side here, or the outside of the hip. And now at this end range position, this is something I do with my patients, a little contract relax technique. Now I'm going to push my knee, or just above my knee. I'm not directly over the joint. I'm at the end of the femur. And I'm going to push my knee up towards the ceiling. So I'm pushing into my hand, I'm resisting it, holding, 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 and then relaxing and pushing further towards the ground. So now from that new position, I'm going to push up again, push into my hand, resist, resist, 5-ish seconds, and relax. And try to push further into that stretch. And I'll push up again, push, 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 push. Breathing into this as well, and relax. So now that I'm in a better position at my hip, now I want to strengthen in this end range position. So if we don't start strengthening after we attain more mobility, flexibility, or range of motion, then we're just going to fall back into our same tense patterns. So now to fire the muscles that help externally rotate my hip, which is the position I'm in, and help counteract my internal rotators, or my tight muscles along the inner thigh and pelvis, I'm going to try to drive my knee into the floor. And as I'm doing that, I'll give less pressure with my hand and really force my muscles now to keep my leg down. So I'm driving, driving, driving towards the floor, holding there, breathing. So keep driving. Now I'm trying to hold even longer. And then I'm going to relax. And as you can see, my knee is significantly lower than it was just a couple minutes ago when it was up here. And that's something to then continue day in and day out. And then as time goes on, your knee will not be up here consistently. It could be here. And then you keep working at it. And then you have less stress and strain going onto the low back. So the final exercise that we're going to do are cat camels or cat cows, depending on your preference, in the chair. So those of you who have done yoga, you've probably done this before, seen it. So when people are on their hands and knees in the quadruped position and they arch and round the spine. For anybody with wrist or knee pain, this is a great modification to do it in the chair, so you don't have to worry about the pressure through those joints. So with your hands resting on your knees, as you inhale, you're going to extend the spine and lean back. As you exhale, round forward. Inhale, you arch back. Exhale, round forward. Now some of you might not have as much mobility in your spine, and that's okay. Wherever you're at today is just a starting point, and there's room for improvement. So even if this is all you can do, that's where you work and where you own for right now. As time goes on, you want to little by little introduce more motion and try to get further into that range. If you really feel stuck or like you can't go any further, again, either A, you can talk to somebody, see a physical therapist like myself, figure out what's going on, and also really focus in on your breathing and how you're positioning yourself into that extension or flexion. And as you breathe, are you able to inch just a little bit closer or get a little bit more range into that movement? So I know we covered a lot, and does anybody have any questions or comments or need me to repeat anything? Just trying to check both screens here. Okay. Let's see. So one question that I got earlier, is it bad to crack my back? So healthy joints should be able to crack, and all it is gas leaving the joint space. However, if there is pain or severe discomfort associated with that crack, then obviously that's abnormal. That's not the response you want. But just because a joint cracks, you move a funny way, doesn't mean it's anything for concern. If it does it pretty consistently, or maybe you have tight hip flexors and that kind of snaps over the joint as you flex or extend, okay, that's just cluing you into, I need to work on my hip flexor tightness, and how can I, improve my hip extension to counteract my sitting. So to actually talk about hip flexion and sitting all day, that actually makes our muscles in the front of the hip very short. And one of our muscles, the psoas, runs from the front part of the spine down to our hip. So it crosses the hip joint. When we are tight in the hip flexors, when we stand up, our pelvis will arch forward into an anterior pelvic tilt. And that puts a lot of stress and strain on the low back. For the younger population, we're able to upright ourselves, we have strength and mobility in other places, so we find our compensation by arching our low back. For the geriatric population, when they're stuck in this hip flex position and they're too tight and they're unable to compensate by standing upright, that's when you find this stooped posture. So to open up the hip, we want to go into a lunge position. And again, if our hip flexors are pulling us into an anterior pelvic tilt, or tilting forward, extending the low back, we want to counteract that with a posterior pelvic tilt. So we're tucking the butt under, and then we're maintaining that as we shift forward. You can also squeeze the back glute here as you do that, so you're maintaining that tuck, you're squeezing the back glute, and you should really feel it along the front side of the hip. You can play around with a side bend here and maybe rotate your trunk side to side, and as you come back, you should feel more length and stretching along the front side of your body. That's also why I recommend, if you're able to create a standing desk, do so, because when we're sitting all day, again, our hips get very tight. That contributes to our back pain and our hip pain. And if you can mix in standing time throughout the day for certain jobs or tasks that you're able to stand, you're able to take a phone call, definitely do it. And the same applications of how you should be optimally sitting and what posture apply to when you're standing. So you don't want it too high where you're shrugged up. You don't want to be squinting in towards the screen. You still want to have your shoulders down and back and comfortably type at the keyboard or move the mouse as you do so. So another question is, can I get better without surgery? The answer is yes. And studies are coming out and showing that 2 years of physical therapy, and that doesn't mean consistently for those 2 years, but it means that you have a plan and you're consistently doing your home program, or at least in between PT visits. And physical therapy has the same outcome as back surgeries. And if I was you, I would definitely choose the more conservative approach and not have all those risks associated with surgery if I could get better, even if it takes a little bit longer. And while there is a time and place for surgery, you know, like my dad's, it was a medical emergency, or somebody who has exhausted all conservative and holistic treatments and they still have that same pain, that's also a time and place for surgery. So it's not to say that some people don't need it, but I would say a lot of people with neck and back pain can get better conservatively. And now a question I went over on Tuesday that somebody asked was, what do I do for pain running down the back of my leg? So this is a common presentation of sciatica. Again, always consult a medical professional first, especially with this exercise, to make sure that it is safe and effective for you. But when we're experiencing pain or numbness or tingling or down a specific part of our leg, so let's say for this example it runs to the back of your knee. When we're standing, if there is a disc that's bulging posteriorly, compressing the nerve, as we extend back, that actually pushes the disc forward and into better alignment between the vertebrae. So what we want to do are repeated extensions. So placing your hands in the small of your back, you're just going to lean back about 30, 40, 50 times. And the response we want to see here is that the pain centralizes, meaning it's now traveling up the leg, so maybe you only feel it in your butt, and now you do another 50 and you only feel it in the small of your back. Even if it's slightly more intense, that's a great response, and that's what we want to keep doing. Now, if you're somebody, you start doing these, and your pain is no longer behind your knee, it's actually in your foot, that is not the response we want. And that just means you'll require a different intervention to best help you. But that one, again, is typically helpful for people with pain running down the back of their leg. But again, consult a medical professional first before you do that. So, just checking any other questions. So if there's no other questions for today, again, thank you to those of you tuning in. And there are still a bunch of workout classes and other courses tomorrow going on with the Wellness Festival. Any donations do benefit the American Cancer Society. It does help a lot of patients and their families battling cancer, so any amount will go a long way. And if you have any specific questions for me or think of any later, feel free to message me either on Facebook or Instagram, or you can call or text me directly at 631-317-1222. And you can head to powerfulpt.com to find out any more about the services I provide. Again, I travel to you if you're on Long Island, and if you're in New York, I can help treat you virtually with a telehealth physical therapy appointment. So happy Friday, everybody. There's a yoga class happening after this, I believe, and stay safe and enjoy the weekend.